So we will start again. It is 3:02. We appreciate everybody for joining us today. You are just now joining us. If you would mute your microphone, please. We can have opportunity for questions. I know our specialists would be glad to answer those for you. Just so everyone knows, we are recording the session today. So if you ask questions, that's great. Just know that it is being recorded. As we look forward to the summer and the opportunities to gather 4-Hers and youth together again, there are updates and new forms for our programs for minors that we wanted to make sure everyone was aware of. So our team of specialists felt that presenting a webinar as well as recording that for those of people who could not join us today would be important. Our team of specialists are Dr. Darlene Locke, Dr. Laura Hebinger, and Mrs. Meredith Naquin. You may know her as Meredith Carter. So they have done an excellent job of looking through the forms that we have to complete, of knowing where those forms are located and the information that we have to put on those forms. And so I'm going to turn it over to them and allow them to share with you the things they think are important. And at this point, we're going to consider everything about programs for minors very important. Again, thank you for joining us, and I'm going to turn it over to the specialist.
Okay, well, howdy everyone, and thanks for being here. I'm Darlene. I'm the 1/4 of the group here to present with y'all this afternoon. Laura, would you flip to the 4-H homepage? And Laura Hebinger is going to run our screen for you. So everyone should be now seeing the Texas 4-H website. First thing we wanted to start with is just to make sure that everyone knew how to easily find the resources that are available to you in regards to programs for minors. So very simply, you're at the Texas 4-H website, you click on the management link, you'll get the drop down and go down and select programs for minors, and there you are. That lovely group of youth there happens to be some youth that participate in our GLOBE program. But if you click anywhere on their photo, you will find a link to the Texas A&M System Rule 24.01.06, which is our Programs for Minors rule that all of this is created to support. Thank you, Laura. Now, if you'll just go back, then further scroll down just a tiny bit more, Laura, I'm going to do something out of order. If you'll click on under requirements, the rule 24.01.06.x1 is the Texas A&M AgriLife extension component of that rule. And I'm sharing these for you, one, for your knowledge and understanding of why we're doing what we're doing, but also, you know, transparency. And if you want to share it with individuals within your community that question why we do these things the way we do, these are why we do them, with the broader element that in all of our programs, we want to ensure that our youth, as well as our volunteers, and as well as you as an employee, are protected in every way possible, so that everyone has a safe environment to participate. Laura, you can go back now. Thank you. Okay, so that's your 2 backup documents. And what we want to start with today is I'm going to review, first of all, this decision tree that we've put here. If you're asking yourself, well, do I have to do this? Does my program mean it's a programs for minors? We have developed this little decision tree that hopefully would help you to know. And it's really 3 questions. The first one being, is your program operated by A&M AgriLife Extension or a third party using extension property and facilities? If yes, you continue on the left side. If no, then you're done. Your second question is, are the supervisory duties of these minors the responsibility of AgriLife Extension or the third party? If it's yes, you continue down. The next question is the program scheduled for 2 or more consecutive days with the same group of minors without an overnight stay or that involve an overnight stay? If you're still answering yes, if you answered yes to all 3 of those questions, then your program is a program for minors. And so what we want you to realize is that programs for minors are not just at the district level or the state level or national or international level. They also happen at the county level. And I don't want you to be overwhelmed or threatened or fearful of what's required of programs for minors, because you're probably already doing it. But what we need to ensure is that as you do the requirements that are dictated by those rules that I first shared, is that we also have a system for keeping all of that data somewhere that it can be retrieved, because guess what? We do get the opportunity from System and A&M AgriLife Risk and Compliance for audits. And when there's an audit, then we can't just say, oh yeah, we did all that. We have to be able to document it. And so we hope that we have created a system that allows you to complete the documentation, but to also have a place to keep all the documentation, so that if your program is selected in an audit, that it's not an undue stress upon you to go and find all that stuff. And so that's what our focus is today, is to help you to have that process of meeting all the requirements and being able to retrieve all the requirements. So one of the first things that you'll notice on the website, we've already reviewed the rule there, but where it says program manager, the language of the rule uses the word program manager. And so we just want you to know that that's whatever AgriLife employee that in the Texas data system has this activity or event as part of their plan of work. So for me, I coordinate the GLOBE program. And so if there's anything done for GLOBE, I'm considered the program manager. Okay, so just know that that's because of the language in the rule. Not only are you a county extension agent or a district specialist or whatever, for the rule's sake, you're also considered the program manager. And then the other thing that what you will do as you gather this data, there's a place that you're going to be able to put all of this documentation. And Laura's going to click on it now, just to show you that it takes you to this site. We're not going to do anything with this right now, but this is where you would actually indicate that you had completed each of the required pieces. And it's a form site, you complete it, I get a report immediately that lets me know that Alinda in Jack County has completed a programs for minors. And so I put her information over in a little folder that I hold on to. And then if we need to retrieve that at any time, we know to go to Alinda for that particular program. Okay, so with that, I'm now going to give it to Laura, and she can do both things at once. She can talk and navigate the website, but that's,
We'll see how it works, Darlene, no guarantees.
So, before we do that, are there any questions up to this point? Because what I've given you is like the overall big picture, why we do it and where we do it. And I'll monitor the chat if we have any discussions there. Please feel free to put any questions over there. Laura and Meredith can be doing most of the speaking, so I can answer questions in the chat, or you can just speak out if it's something you really want to hear. Go ahead, Laura.
Absolutely. Okay, so next on the list, we're kind of going, for the most part, through the website here. So the next thing on the list is background screenings. And as you know, they have to be completed, or I hope you know, is they have to be completed every 3 years. The nifty thing about 4-H Online is that it's automatic. So we know if they're in there and they're approved, when it's their turn to go, they get it every 3 years. This is every 3 years of a program year, if you will. So if they enroll in August, or I should say August 15th, they enroll in September and they get their screening done, it's good for this 4-H year, so the 2020-21 year, then the 21-22 year, and the 22-23 year. Then in the 324 year, oh my gosh, those are a lot of numbers. That year they would need to be rescreened. But the nifty thing is it's automatic. As the program manager, like Darlene talked about, you are responsible for making sure that all of the volunteers involved in your program for minors has an approved status in 4-H Online. If you want to read the rules about the YPS program or the Youth Protection Standards, they're all nifty. They're right there. They're linked actually 2 or 3 times on this page, but they're right there. So again, we're going to look at 4-H Online. If they have an approved status, then we know that everything is up to date. But if you kind of want to get an idea of see what's going on, there are some things, there's a custom report that I created and shared with you. And so we'll go through how to find that report. I logged into 4-H Online as a, like as if I were in a county. And so let me get my mouse over here. And so this is what you would mostly see when you go. The name of this county is called Training County. It's kind of a dummy county. So it doesn't have a lot of real information in here, or a whole lot. If you search for a member, the first thing you should usually do is click clear filters, and you're going to get all of your members that are in here. As you can see, we don't have a lot of data in this Training County. It's a lot of dummy information. But if they have the status of approved, then we know that they're good over here. I thought there were some. Obviously, I'm losing my brain. But then you can also go over here to screenings, and you can search for a keyword here. You can search for the status of what it is, and you'll get that report. You can click, let's see, let me clear my filters and do a search one more time. I really thought there were some more in here when I looked yesterday, but I guess things changed. But then you can click download that Excel button, and it will open up a report for you. Where's my report? It's on my other screen. Let me drag it over here. Oops, wrong report. Let's see what we got. Bringing that over here. And as you can see, everything that was on the screen is now listed, and we know that this is incomplete. But if you want a little more detail, which is why I created the custom report, you can go in 4-H Online in the left navigational pane, and I have those steps listed out for you on the website. You can go to custom reports down on the bottom left. And as you can, when you log into your profile as a manager, it'll say your county name here. So it would say Anderson or Brazos or Jack or whatever. It would say the county name here. You click on that, and these are reports that have been shared across the state. So there's one I created called Volunteer Screening Status. So you can click on that. And then over here, what I like to do is just go ahead and click Download Excel. A little red line go across the top. I'm going to open it. And let's see, as it's doing that for me. Okay, we got this basically the same information earlier as we saw earlier, but I'll show you. I pulled a report yesterday, including the whole state, just so that you can kind of see what it looks like. I've hidden the county, so column A is hidden over here, and I deleted the family names and last names, so we're not sharing any personal information. But you'll see something like this whenever you download that report. One of the nifty things about the custom report is if you needed to see something, I went ahead and did include the family email address in case you wanted that. And then you can look at some of these restrictions. A few questions I've gotten from folks as they've looked at this. Do you see this screening type here? There's a level 1 or a level 2. A level 1 is our volunteers. A level 2 are our employees. And so we'll filter this to just level 2. And I'll show, here we go. We've got an incomplete employee. Tommy, whoever this is, has said that he's an employee, but hasn't finished submitting it. So it's incomplete. So we have over here, the screening approval year does not apply because he hasn't finished it out. It's sitting incomplete. It doesn't matter. It doesn't do anything. Then we've got all these other employees that are approved level 2. And I hand typed this term in here, employee. As you can see, I missed Derek's on there. That was kind of an accident on my end. There's about 5 employees like that. But as you can see, it's denoting that they're an employee. We verified that in the system. And it says for this 4-H year. Now let's go back and look at our level 1 folks, you can see these people that have have where it says no restrictions. These are people that were screened in previous years. If you can see on my screen, I hope it's not too small for you, but anyone that was screened in the last 2 years, that term no restrictions carried over from the other program from 4-H Connect 1.0. But our folks from this year, so let me add all those filters back in there. Our folks from this year, they don't have that statement in there, just so that you're aware, they don't have a restriction there. But you will see a few people with some restrictions. So we've got people that are restricted from driving youth other than their own children. And if you'll notice, their screening status is restricted. Here's another little nuance in the system that I want to point out to you. If we pick the 18-19 year, and we've got folks that are have some restrictions of like no driving or no handling funds. Notice their screening status is approved, not restricted. The way it came over from the old system, they were shown approved as their screening, but their restriction is listed there. Again, you should be able to go pull this report for your county and see what you've got there. I think that's really the only thing that I would want to, I think those are the main things I wanted to show you on that report. So we'll go back to the website. Yeah, we'll go back to the Programs for Minors website where we are. So a couple of other things to note there is the Excel spreadsheet download can serve as your documentation on the background checks that they've been done. And this documentation needs to be maintained for a minimum of 2 years in a secure location. As a reminder, any of that information you see with restrictions as far as no driving or not handling funds, those restrictions should be treated in confidentiality. You don't share that with other volunteers. You can share that with other employees so that they know, but that information should be treated within the strictest manners of confidentiality. Okay. Oh, I want to show you one other thing on the website before I forget. You do also have this button. I've not put a big email blast out about it that I showed you here, this screening. And I wish I would have had one that had over here in this column called batch. If they have a batch number next to them, that's my batch number when I send it off to the screening company. So if you see that they have a batch number, you know that we've seen it, we've sent it off, we're just waiting for the report to come back. And the submitted date would be the date that your volunteer submitted their screening, not the date that I submitted it off for screening. It's the date that your volunteer hit submit on their screening information. And reviewed by would either have my name or it would say Youth Protection Standards Student Worker. Okay, I'm going to go down the page a little bit. The next thing on the list is the waiver. This is not anything new. You should have seen this before in the past, the waiver, indemnification, and medical treatment authorization. These forms have to be collected on every participant in a program for minors, again, both youth and adults. We want to have these in place before the event starts. So it's a good idea, you know, again, to collect that before anything begins, either at check-in or ahead of time during registration. Here is the waiver. This shouldn't look anything different than what you've seen in the past. Well, it does look a little bit different. Let me clarify. This year, a COVID statement was added. So number 3 is the COVID statement. Back up. Look at the top here. It says 2020, 2021, 4-H year. Make sure you're using the current one every year. So this one has the COVID statement. And we go on. One of the things that we've seen that happens often is people upload these and they miss signatures. And so it's extremely important. I think we put it at the top of another document we're going to share later. The number one thing is they fill out these forms and they have to be signed. So make sure we've got a date. And then here, the participant signature or the parent or guardian signature. Again, if the student is 18, they could sign it themselves. However, I always like to be that stick in the mud. you may be 18, but you still live under mom and daddy's house. You're a 4-H member. Get your mom and daddy to sign it. And so that's a Laura thing probably. But they can sign it here. We need a printed name and then the legal guardian signature and printed name as well. Another very important thing is we need to make sure we have an emergency contact number other than the parent who's already put their information on the form. And then we need their insurance information. What's their insurance company, policy number, and the policy holder. Here's another important piece. Any special services your student requires or the 4-H member requires. And then this last statement down here, we're going to talk a little bit more about this statement. But basically this statement is saying they're going to tell us everything that we need to know about their kid, any special circumstances or special needs that they may have. And again, we need to make sure that there's a signature for this statement as well. So this form could have up to 3 signatures, a minimum of 2, the 2 parent signatures, the one here and the one down here, plus all the emergency contact and stuff filled out. Another thing I learned this from Doc Locke on here, is we don't need to change this form. This form should stay as it is. We don't need to go and add things or take things away or change the font or make it smaller like I used to do. I've learned that was wrong. I shouldn't have done that. So this form should be used as it is. Go back.
Now,
Yeah.
Laura, let me clarify.
Okay, please do.
Go back to the form, and it
Okay.
even says it on the, go back to the form. You said not to change it, and that is correct. But there where it says program name, you can change that. You can put your name, like I would put Globe 2021. And also at the indemnity clause number item 2, you can go in there and you can add, I know, let me see.
Or is it
Right here in this area, if you are doing something that has very high risk items within it, your activity involves very specific risk, you can add those. So like if you're going to do bungee jumping, you could add that. If you are going to go whitewater rafting, you would want to add that. But back on the website, go ahead and go back to the website, Laura. And this is a system policy. It's not this is what you should do. But the Office of General Counsel is the one that agrees to this form, and they specifically have this instructions that make sure the language that is bolded, underlined, or italicized remains the same. And so there's your things you can change and should not change. Okay, go ahead.
Sure, Darlene, there's 2 questions in the text chat. Did you want to
Yeah.
catch those?
You can use this form for non-4-H. Okay, the question is, can we use this form for non-4-H day camps? The waiver is there to protect Texas A&M, all those entities listed at the top of the page. The 4-H Youth Development Program. Go back to that.
Yes, the employee.
Go to the waiver.
Yeah.
So this form only protects those entities that are described in item 1. If you are doing this at a different location, say you're having an event at someone's barn because they're letting you use this does not cover them. You would have to have a separate waiver for that particular facility. So this is only for AgriLife sponsored events. Okay, can program name be edited? Yes. This is a PDF and there is a Word version of it available. Yes, there is. Okay, and if a family tells you they do not have health insurance or they pay out of pocket, please just have them put that on there. And I think there was another question. Insurance is not required of participants to participate in our programs. We just need to know if they do have it, if you have full care of them, if you need insurance because they get injured, it's a good thing to already have it, to have a copy of it. Okay?
Yeah, I think those are all the questions.
Okay.
All right. So next up on the list is the child protection training. If you noticed this year or not, the child protection training was added for all volunteers to complete versus in the past, we've kind of had specific criteria where we said, you know, these types of volunteers need to have it. but we went ahead and made it required for everyone this year. And we took the other 2 trainings and we combined them into one. Doc Locke and I worked on that together. And so if you've listened to that other training, you got to hear my voice. But the child protection training is one that is was written by legal, that is required by law. We have to do that. Now this training is completed every 2 years. So that's a little bit different than our volunteer screening. Again, the nifty thing about 4-H Online is that it automatically does that for us. And so if they have an approved status in 4-H Online, then there's nothing that you should worry about other than getting that documentation that they were approved. Now, if you're doing something maybe not related to 4-H, and so that, that volunteer is not in 4-H Online, we're doing it with another youth audience or something of that sort, but we need to have this program for minors, this child protection training on board. That volunteer needs to have that. They can take that training through the Train Track External Gateway. Again, this is the same one that you take as an employee. You can do that through the Train Track External Gateway. And it is, again, your responsibility to make sure that gets done. If you have someone doing it through the external gateway, that password gets updated periodically, like every 30 days, 90 days. I can't remember what it is. But Doc Locke and I are both on that list to get the email or on that email list to get the password. So just shoot us an email, say, you know, you got someone to do it, and we'll send you that password as we get it. So let me show you how to download that report out of 4-H Online. So again, we're back in 4-H Online. I'm in this training county. I can click on trainings here, and I've clicked clear filters, and it's showing me these are my volunteers. We got someone named Mama Training as we were playing with this, and Mama Training is incomplete on both the child protection and the volunteer orientation. She started them on April the 5th, but has not completed them. Kyla over here has completed both of these back in November, completed them and started them on the same date. We've got another one that's in progress and another one that's incomplete. You can do the same thing here by clicking download Excel, and you'll get that. The thing you don't get in this report as it's opening up here, hang on, it's thinking about it, is you don't get their email address if you were to want to have that documentation. You don't get that here. You see everything else on the screen here. You can, let me go back here. You can click the broadcast email button and send them a broadcast email saying, hey, that you're incomplete. So you could find all the people that are in progress or incomplete and do a search. Then you can click the broadcast email and send them a reminder saying, hey, you need to do this. Or I have also created a similar report in the custom report section called volunteer training status. And you would click that again and click download Excel. And I'll show you the one I pulled statewide yesterday, where I've again deleted out some of that information so that we don't have personal information being shared. But as you can see here, we've got like when it says does not apply, that means our training is incomplete. Otherwise, you can see the year and you can show when they are complete. Again, does not apply. It could also be in progress, which really means incomplete. And then the certificate name and the date that they completed it. The other thing I'll show you is that there's the training name here, the child protection training and the volunteer orientation. And so you can sort those however you need to. As a reminder, the training is good for 2 years, and the training, it's automatic. So if they take it in November, it's not good for 2 years in November, it's good through the program year. So when they re-enroll that 3rd year in September, they will need to retake the training. It's not like the training is good September, October, and November. So that's the child protection training stuff. Okay, come on. I need that little screen to go away. And here we go. And then that one also, that needs to be maintained for 2 years in a secure location. You can download that spreadsheet or take a screenshot. Okay, Darlene added all volunteers are now required to complete those 2 trainings. So if approved, they are completed. Yeah. And then Jessica's asking, can you talk more about the Programs for Minors event checklist site? And yes, we're actually going to do an example of that at the very end, Jessica. So we will get to that. That's at the end of our agenda here, or I think it is.
Right, but all of these elements are what go into that event checklist.
Yes. So that's why we were going to go through all of it first. Yeah. Good point, Darlene. Okay. So incident reporting. One of the things here about the incident report, if something happens, if you've got a broken leg, if you've got to send someone to the hospital, well, hopefully that's the same, a broken leg goes to the hospital, but any of these incidents and accidents, we need to participants or volunteers or employees that are there. Employees, you have a whole nother list of forms as well, but for our volunteers and our participants, we have to fill this out. Reports need to be submitted to your immediate supervisor within 24 hours, and then you just need to maintain all of your documentation. So I'll show you this. This was adapted from something from the A&M system, covering all these fun things that you would want to gather. Time and place, location, any of the information about the premises, was it raining or where it was, what the conditions were. If a police report was filed, let's say if there was a vehicular accident or something like that, and you get the report number, describe what happened, use that additional sheet of paper if you need to, attach it or write it on the back. Who was the person injured, and a description of the injury, and if there was any medical treatment. If there was any property damage, whose property was damaged. Again, on these things, use additional sheet if necessary to attach, because they're kind of small boxes. And then if you have any witnesses that can provide additional information, let's get their stuff on there. You as the program manager are most likely the one to be filling out this report, but if it's another employee that's there that comes across the incident, maybe it's more logical for them to fill out this report. And then there are some instructions. Again, number one thing, if there's a problem and we need medical attention, call 911. That's the highest priority. Get them the help that they need. And then once we report those, get those things done, let your DEA know or your immediate supervisor. And then that will be also passed on to Dr. Williams to make sure that we all understand what's going on, and then forwarded on to AgriLife, who is it? Ethics and Compliance is what it says here. And so this is something that we should be filling out as either the program manager or employee. This is not a form you give the injured person to go fill out. So try to gather as much as you can right there. Be observant in what you're doing. And this is not something you should go and post on social media or send emails to all these people about what happened. Of course, we need to let the parents know if a child is injured and that type of thing, but we don't need to discuss this broadly and widely. This needs to be kept, kept close, and so that we report things correctly. Okay, any questions so far? Super fun and exciting stuff. The next one here is, this is another very serious topic here, reporting child abuse and other maltreatment. You should know this as an employee. You've been through the trainings, or I hope you have, and that you're current, and know that Texas law requires, and I'll just read it here. Texas law requires any person having cause to believe that a child's physical or mental health or welfare has been adversely affected by abuse, neglect, or other maltreatment to immediately make a report to law enforcement. And there should be no retaliation. You have immunity in making a good faith report, since you are not responsible for verifying whether that is actually occurring. That's not your responsibility. You don't need to get involved. You don't need to start your own investigation. If you have a suspicion that it's going on, you by law, not because you're an employee, but because you are a citizen of the state of Texas, you are required to report that. Call your local law enforcement agency, either the local police, municipal police department, or the county sheriff's office. But if it is an emergency, of course, dial 911. And then after that, once you've done that, report the situation to your immediate supervisor, and we'll make sure Dr. Williams is also brought in the loop so that he knows what's going on.
Laura, we have a question in the chat. If we had kids sign the waiver at the beginning of the year, do we need to have it re-signed for every program? And that could be youth or adults. The waiver can be used for the entire year. It is important that for the particular event that the waiver is signed prior to the event. Also, there is a place within 4-H Online that a person can sign a waiver, but it's not required. And so you can go into your 4-H Online and pull a report for a participant in your program. And if they did in fact sign the waiver, the parents signed it and the youth signed it, you could use that for your event. But it's very important, if you're going to use that procedure, that you verify that all those signatures are in place. Our recommendation is it's just, you're either going to have to do the homework through 4-H Online to make sure that it was signed and it was signed before your event, or you could have them do a paper version per each event. It's totally up to you, but the responsibility lies with you to make sure that it is done properly.
Yeah, good question. And actually, that's in my notes here, Darlene, and I forgot to say that.
Yeah.
It's
To be-
not required for membership, but
Right.
it's required for participation in activities.
Yeah, and that's the difference. We cannot require people to sign a waiver just to be a 4-H member, but we must require them for the event.
Good question, Travis. Yep. All right, moving on to another super fun and exciting topic, risk management. All programs for minors programs, you need to have, where we have full supervisory duties or responsibilities over these minors, we have to do a risk management assessment. When I first saw this matrix, I was like, whoa, this is a little much for me. But Darlene's predecessor in this position, I don't know if y'all remember Dr. Jill Martz, but one of the things Jill told me was, these are things you're already doing. So don't get overwhelmed by this. This is not hard. It's not meant to be difficult. And oh gosh, Darlene, it looks like we put the wrong one up here. Step 5, we had an updated version, so we'll have to fix that. And we had an updated version. You don't want to send this to system risk management. It stays internal. So oops, I thought we had caught all these things, but we're getting there slowly but surely. But essentially what you're going to do is you're going to evaluate what program is going on and what activities that we're going to be doing. What are the risks associated with it? We're going to look at the seriousness. Is it a 1, 2, 3, or a 4? And over here is an example, and I'll make my screen a little bit bigger so y'all can see this. A 1 being extremely serious may result in death. 2, severe injury, major property damage, significant financial loss, negative publicity for the group or institution. Number 3 may cause minor injury, illness, or property damage. And number 4, a minimal threat. And we look at the likelihood or the probability that it's going to happen. This is probably the highest level, or this is going to be the most frequent, most likely to occur in a short period of time, expected to occur frequently. B, will come in time with enough activity, it's likely to occur. C, it may occur in time, probability is lower, and there's an equal chance of it occurring versus not. And D is unlikely to occur at any point. And so as you can see, the red is kind of the more serious, yellow a little bit, and then we use blue instead of green here. I guess we're not saying green go light, but it's kind of the same process. And then the second page of the form has more spaces to fill out. I wanted to show you a couple of examples, and I have some here. This one is for an event that was done at a county 4-H camp. And they said swimming, a risk is drowning, seriousness 1. I guess we didn't fill out the probability. And the way we're going to mitigate that risk is through certified lifeguards. Archery, they could get shot. Injury 2, I guess death 1 and injury 2, that's the probability of these occurring. And so they've got safety instructors, if I could talk, kayaking, and a low ropes course. I'm trying to think if this one had a second page. No, this one doesn't. This one, someone filled out on a Excel spreadsheet. and wrote down, oh, that's the headers here, but a vehicle accident during transportation. Part of this is cut off here, but youth will travel with someone in charge. We've got the insurance, we've got permission slips, setting up camp. Let me find another one that you can see the whole thing. Showed you that one. Here's one. Youth placed in homes here, individual homes, physical contact, physical injuries, illness, sickness, and a vehicle accident. So the seriousness level was assessed here and the probability. And we were going to do background screenings, home visits, orientations, references. So again, things that you're already thinking about, things that you're doing. And I have an example here of one that I did when I took kids to District Leadership Lab. Our antiquated activities, we could maybe have a minor injury. So we've got safeguards to prevent those things. Adult chaperones will monitor. We went to Schlitterbahn when we were New Braunfels. There's trained lifeguards. We require the kids to check in. We bring the release forms to the park in case we need them. Again, some vehicle accidents, using a recognized bus company, someone that's certified. And as you can see, meals or snacks, that's something that I didn't see on the others. Food poisoning or allergic reactions. We'll review the health forms prior to camp. Food will be prepared. So these are things that hopefully you're already thinking about as you're doing it. So let me go back here. Let's see. If you do have some questions, call your district 4-H specialist, call Doc Locke. We're here to help you fill that out and make sure that you're doing all that. And then this documentation, the rule says we have to keep it for 3 years. And I think the last thing that I've got on my list before I turn it over to Meredith is the ADA accommodation statements. And y'all have probably seen this before, but as a reminder, this is not the EEO statement, the equal opportunity statement. This is the one that says we are open to everyone coming to our programs for education. And there's a statement there, but here's a good set of guidelines that are, oh, I had it opened earlier. Accommodation guidelines for persons with disabilities. And so the first statement is you need to put out there on all of your materials, if you need any type of accommodation to participate in this program or have questions about the physical access provided, please contact, list the name and number of the county extension office and who the person is in charge by this date. And that is either at the time of registration or at least 2 weeks prior to the event. As y'all know, that comes up. We've got kids that participate in things. So like an injury, like being in a wheelchair or on crutches, you know, that may be a temporary thing that happened shortly before the event, you know, and registration was several months prior. Or it could be someone that needs an interpreter of some sort, like someone to do sign language. Or, oh gosh, we have kids participating in consumer decision making all the time that maybe have dyslexia or something like that. And so, again, these are things that we should be somewhat prepared for, but it may be something you're completely unprepared for. That's why we put that statement out there. And they should be made to the extension office and as directly to the person in charge as possible. And then I won't read all of this through here for you, but here's some guidelines to go through, kind of some steps to follow. You become aware, you find out what it is, you ask the person what their limitations are, and then you go from there. One nice thing about this is there's a checklist here that could help you some guiding thoughts. What is the disability? What are their limitations? What is the event that they would like to participate in? When will it be held? Describe the facility. Do the limitations prevent participation? If limitations prevent the members' participation, are there any reasonable accommodations that we can? Yes or no? Again, Darlene is here to help us should you have these questions, or if you have questions as you go through here. Remember that we don't have to alter the fundamental nature of the program or essential criteria for participation. In competitive events, participants with disabilities should be judged by the same criteria as others. Functional limitations with or without reasonable accommodations should not pose a direct threat to the person with a disability or the other participants. A direct safety threat means a significant risk of substantial harm. And then you would, gather all this information and have it ready to go. One of the things when we're talking about accommodations, like for learning disabilities, a lot of times I like to ask the question, what do y'all do at school? How does school help you through that? And sometimes that'll help guide our conversation. That's kind of an easy way. Or what do you need? Maybe a question. And then if you're unsure if it's reasonable or not, take your notes and say, okay, thank you for that information. Let me find out what we can do. And then pick up the phone and call your district 4-H specialist or Darlene, and we'll be here to help you through that.
Yeah. So Laura, I think one of the more common ones that we've been seeing lately is like kids at a livestock judging contest, and they have trouble bubbling in that Scantron, either because they have a direct learning disability, like with dyslexia or something like that. Or we know a couple of kids in our program that have Erlin's syndrome, where they can't see specific colors unless they have their glasses are normally like a red or an orange. And so we normally just ask like, okay, so what can I do to make this better for you? How can I help you? And a lot of times they're pretty forthcoming with that information. Sometimes a parent doesn't want to disclose that, and that's entirely on them. But they have to know at that point that it's not our responsibility to go seek that information. It's their responsibility to disclose. So
It is, Meredith, but it is our responsibility to ensure that that statement is on all promotional material so that they know it. So it's something we haven't always done, and we're getting better at it. But just as you begin creating your announcements about events and stuff, try to keep this one in mind, because it's a great thing. We have more and more young people that see 4-H as a place that they can participate. But as Laura pointed out on that paper there, there is a procedure, and we accommodate on a case-by-case basis. Hopefully we can, but it doesn't mean that we always can. So as she indicated, when you encounter those situations, contact your district specialist, because Meredith and Laura have probably already seen some of those same situations, or other district specialists have. And then not lastly, but at any time you can contact me and we can walk through what to do. Okay, there is a question in the chat. If agents take members to a contest with an overnight stay, do they have to complete the forms? Okay, Laura answered it, but at the top of the page and beginning of the training, the thing is, if we have full supervisory responsibilities, you should be completing these forms. And especially if you're going to be overnight, even more so.
But Doc Locke, I think one question that comes to mind, and we should probably clarify, is if they're going to an event like District Leadership Lab, it's the responsibility of the program manager to fill that form out. Not
good point, Laura, Meredith. Yeah. So, and we three talked about this before doing it. So it's whoever is in charge of that program does the documentation for the program's reminder. So District Leadership Labs, your district specialist is doing it. If you're doing it just in the county, then you as the county extension agent, AKA program manager, are the one that completes and has readily accessible all the documentation.
The other thing I would add to that is you're taking kids again to a judging contest or to a district. So you're taking to a district contest, food challenge, livestock judging, consumer fashion show, whatever. We're staying overnight. That is not the district specialist responsibility to do that. If they're staying with, again, if a volunteer has full supervisory responsibilities, then you as the county need to make sure that that's done, because you're supervising them getting there. We as the district are not hosting we're not chaperoning that event. Your volunteers that are coming are chaperoning. Now, if they come with their parents, you don't have to have that. But when we had full supervisory responsibilities with a volunteer or you as an employee over those young people, then yes, you should have those forms in place.
And so an event that's coming up very soon would be Texas 4-H Roundup. So Texas 4-H Roundup does not provide chaperones for the overnight stay. County programs are responsible for ensuring that the volunteers that are with youth or the employees that are with youth in an overnight situation. So then it falls back on the county for that time that you're chaperoning the youth. Jana Barrett will fill out everything about Roundup, the event, the contest, and all of that. But you're the ones that have the supervisory responsibilities of the youth that are going to be in the Roundup contest. That gets a little tricky, but if you're going to transport the youth from X county to College Station, then you would want to have your documents in place. Okay, hopefully we haven't confused you.
Probably, but whew, I think it's
Okay.
turn. Do you want to share the screen, Meredith, or you just want me to keep clicking?
Why don't you just keep clicking?
All
I think
right.
it's working. So the next big thing when it comes to working with youth and chaperoning our youth comes when we are handling their medications. And so we've put some procedures in place. There are some new forms in place. These forms have not ever been released. They are now live on the website. But we do think that these forms are very useful. And it takes a lot of that gray area out. And so when Doc Locke and Dr. Hubinger and myself were talking about all this, I came from a district perspective and needed to help agents clear up a lot of that gray area of like, okay, well, this is what happens at Leadership Lab. And Laura and I had several discussions on like, well, a kid comes up and wants Tylenol or ibuprofen. How do you handle that? We've never really had a form on how to handle that or very specific procedures. And so these forms and procedures are very specific now and give us that opportunity. So Laura, remind me, is that document live or was that the procedures for handling medications? No, it's not. There we go though. So we've created a 2-page document, front and back, if you want to print it, that really kind of explains everything when it comes to the procedures for handling medications. And so we're going to walk through this, but it's our responsibility to maintain the safety of all of our participants. And this is included for the programs for minors. So that means events that are more than 2 consecutive days with or without an overnight stay, and where Extension has full supervisory responsibilities. So we will maintain these documents and protect them as they are protected by the HIPAA Act. And so it's our responsibility as a program manager, as a county extension agent, district specialist, to make sure that this information is strictly controlled, kept in a locked box, a secured environment. If you're in a location, y'all, and you don't have a place where you can store these things, right? Go lock them in a vehicle. I mean, I've done that in a time or two when I didn't have a secure location. And so I just went and locked them in a vehicle. I knew that they were locked and safe in there. But it's important to note that these forms should be retained for at least 3 years at the extension office. Yes, Laura just highlighted something. We want to make sure that the parent and guardian name, signature, and date are included on all forms. The date is so important. I know a lot of people think, oh, it's not that big of a deal. It's the same time every year, but it is so important because that date tells us when that form was activated in a sense, right? And then we also need to make sure that we have an emergency contact name and phone number other than the parent or guardian. We need to be able to contact somebody who can get to that parent or guardian if we can't reach that parent or guardian. So let's, Laura, if you'll keep scrolling down. Oh yeah. So if you are at the Texas 4-H Conference Center, here's the good news. They do it for you. They do it for you. So as a district specialist, sometimes it's like, man, it's a little bit easier for us to go to the districts, to the Texas 4-H Conference Center, but they have an established protocol there that they have to follow. They follow different procedures due to their designation and accreditation with the American Camp Association. And so things are going to look a little different than how we do them if we're at a different facility. But nonetheless, they collect all this information for you. Sometimes it's a little easier. So how do we collect, store, and administer those medications? We prefer that we have a designated medical professional, nurse, first aid person on site, right? Maybe you have a volunteer who comes that is a nurse, an LVN, an RN, somebody who has a medical designation. But when we don't have that luxury, the designated first aid person needs to be the program director or in some cases a designee. So for instance, when we go to Leadership Lab in District 11, it's a lot for me to control and to facilitate a lot of things. So a lot of times what I'll do and what I'll say is, okay, Denise, you're the county extension agent in charge of making sure that medicines are handed out and documentation is handled appropriately. And so sometimes we put a trusted individual in that place. So we collect and store and document all of that information with their designee or the program director. If this is really important, medication needs to be stored out of reach of all participants or locked in storage that it doesn't contaminate food. If medication requires refrigeration, it needs to be stored separately from food. And that anytime that we administer medication, prescription or over the counter, it has to be administered on the ADM form. And we'll walk through those forms in just a minute. Here's the biggest one that we get, as a district specialist, I get this question quite a bit. We have a number of youth who have inhalers or EpiPens, insulin, or different medications that are life-threatening conditions. Those stay with the child or with the youth at all times. There's things that, and y'all, I'll say this, those kids that are on those types of medications often know what works and what doesn't work. And they know when they need it and they know when they don't need it, and they know how to administer it themselves. And so we really need to make sure that they have that at all times. Youth with the SAP form may keep that form in the room. And so we'll walk through those forms on the next page and what they mean. But those are some important notes. So the first form, we've talked about it, the waiver, indemnification, and medical treatment authorization form, that is a required form. This form is essentially their permission slip, right? We've talked about it, Laura talked about it, Dr. Lockett talked about it. The next form is the health and safety statement. This is also required. Yeah, I just saw that, Laura. It is required. It is not recommended. We will update that form. In fact, I'm pretty sure Laura will do it as we're talking. So this form is really a questionnaire, so to speak, of like what health issues, special needs, any allergies that they have, anything that we need to know about while they are under our full supervisory care. The program manager, along with the designated medical or first aid person, needs to review these documents. Those are the only two people, one or two people, depending on who they are, who need to review these documents. These documents are not for public knowledge. They don't need to be shared. But this is the form where They would disclose like any food allergies, medical allergies, I think last year I had a child come to camp that had recently had a surgery. And so there was some limitations there. And so just making sure that they disclose all of that. The next form is the authorization to dispense medication. This form is required. If and only if medication is brought by the participant. We don't need the form if they don't bring anything, right? But this form is collected for each youth who brings any medication to that event, to our event or activity. And if it's prescription or over the counter, they need to be in original containers. You can't have mama send 3 days of medicine in a Ziploc baggie. You can't, that stuff doesn't fly. And it really does us no good when it's in a Ziploc baggie and we don't know what it is. I mean, so when we see the prescription bottle, there's descriptions on there of what the pill is supposed to look like. When you get an ibuprofen bottle, there's things like that that are supposed to, so we know what they're supposed to look like. Or if there's any discoloration, you know, some medications deactivate when exposed to the elements. And so that's really important. So if there is a medical emergency, we do not need this authorization. If there's a medical emergency, I'm hoping you've called medical authorities like 911, and they're going to do what they need to do to administer life-saving measures. So and at that point in time, it's out of our hands, right? It's not in our control. This is way beyond us. But that's important to note. The next form that we're going to talk about is the parent guardian authorization waiver and consent for over-the-counter medication. That's a mouthful. We will call that the OTC form. And it's exactly what OTC stands for. It is a permission slip for us to administer over-the-counter medications. Tylenol, ibuprofen, Pepto-Bismol. 1 year Imodium. There's all kinds of things like that, allergy medicine, Allegra, Claritin, those kinds of things. So if we have this form and it's signed, then we don't have to pick up the phone and call mom every time we need to administer something. So what was happening when I was at Leadership Lab with these kids was they'd get a headache. Well, Miss Meredith, can I just have some Advil? Do you have Advil? And I logically know they probably take these medications at home, but I can't give it to them without consent. And so I'd have to say, okay, well, go get your phone and call your mom, and I need to talk to your mom. And I'd have to say, so-and-so, can I give your child the appropriate dosage of ibuprofen? And by the way, can you email me giving me this permission, please? So I had a documentation. And so this form solves all that. It's not required, but it's recommended. And I can tell you from a district perspective, I'm going to highly encourage it. It's a lot of forms, but it makes our life so much easier when it's done. Generic equivalents are allowed when available. And so we don't have to give Advil or Tylenol. We can give ibuprofen or acetaminophen. And it may or may not be done under the supervision of medical personnel, but it will be done under that designated first aid person.
Meredith, can I add something there?
Sure.
You said like Allegra or Claritin or something like that, and it made me think. We're most likely not going to have Allegra or Claritin in our camp first aid box, but we may have Benadryl. But if they do take Claritin or Allegra or something regularly, that would be documented on the ADM form, the authorization to dispense medication. That's for prescription or over-the-counter meds that the parent sends with the child. This OTC form is stuff that we would have on hand. Like, again, we have a camp first aid box that has Tylenol and Neosporin and Band-Aids and those types of things. So I hope that makes sense. Anything that the parent sends would be on the ADM.
Correct.
And anything that we'll have on hand would be documented or possibly have on hand. We may not have it on hand.
Yeah. So yeah, you bring up an important point. We don't have to keep anything on hand, right? It's a good idea. Do I travel with a few things? Absolutely. But they don't necessarily have to be kept on hand and available to be administered immediately. Does that mean that I've not sent somebody or gone myself to the local Walgreens in Brownwood, Texas to get whatever we've needed? Yes, I've done it. Not necessarily Brownwood, because normally the nurse's station is fully stocked. But so the last form is called the SAP, and it's the Parent Guardian Authorization Waiver and Consent for Self-Administration of Prescription Medication. Again, a lot of words. We're going to call it the SAP form. This form is optional, but what it does give us the ability to do is it gives us the ability to, it gives that child the ability to self-administer their medication. So I like this because a lot of times if they're on a prescription med, especially if they've been on a medication for quite a while, they know what to take. And so this form just allows us to hand the bottle to them or hand whatever to them and allow them to take it. Now, I say that knowing that it is a best practice and it's a recommended that medications be picked up, especially if you're staying in like a dorm type situation. They may not be picked up if you are in a hotel type situation, right? It's going to be up to the program manager to decide. And it's going to be up to the program manager to decide whether or not they want to use this form. Some managers don't want to. I probably want to err on the side of caution personally as a program manager. I don't like the idea of medication being passed around or even the thought of it being mishandled or anything like that. So all of this to say, if you have any questions, contact your district specialist. They are here to walk you through it. They will help you and assist you with everything. You'll see here on the website that we have PDF versions of all of these forms available. There's the HSS form. And Laura did a fabulous job of making these PDF fillable. So they are available and fillable for you to use. So the next thing on my list to cover is general liability and accident medical insurance. And so
Meredith, before you
What?
go to that, let Laura flip through these forms
oh, okay.
and talk about, point out some things on them.
Oh yeah, we can do that. Sure. Laura, will you go back to the HSS form?
She's on it.
Okay, there you are. So this is and so you'll notice in the top right-hand corner, there's 3 big letters and it's their abbreviation for what the form is called. So you don't have to guess as to what it is. But we need this form is filled out as much as possible. The one that is super important, you'll see there is the parent or guardian signature and the date at the bottom. So we do need that. We need all of that information as much as possible. The next form is the ADM form. So this form is 1 per child. And what we'll do, happens here is all medications come in the original container. What I like to do is get the medications, put them in a Ziploc bag, and then put this form in there too. So the form stays with the medication. The parent can give us the medication, the dosage, when it's time to be given, special instructions, those kinds of things. And then where it says staff use only, that's for us as staff. Staff means us as program manager. This is where we'll document when we gave it, how much we gave, that kind of stuff. I'm trying to think. And yes, Laura, at the bottom is pointing out that there is a signature, a spot for a signature and a date. And so we will need that.
And then the last thing on that, you keep all of these forms with you. Do not send them home with the participant.
Yes, absolutely. So I made the mistake my first year. I sent the forms home with the kids. I just sent the bag home with the kids, not even thinking of what was in the bag. And I was like, hey, here's your meds, take it. And they were like, but do you need the form? And I just sent it home. Luckily, I've never gotten audited, knock on wood. But that's super important to keep those forms with us. So the next form is the ADM. Do you have the ADM? Oh,
We
this
just-
OTC, we'll just walk through. This is the OTC form. You can see here, there's a list of things for them to check. They'll fill out the information at the top, the name of the event date, that kind of stuff, any OTC form, medications that are there. And then at the bottom, there's a spot for a parent guardian name and signature. So it seems like a lot of information, but like we've said, and I tell my agents this, it's better to be prepared than it's better to be proactive than reactive. And so this gives us an opportunity to do that. This is the SAP form. Again, this form is only required if the program manager allows it, and it's only for participants 15 years of age or older. So anybody younger than 15 years of age, this form would not apply. So you'll fill out all of that information, and then of course make sure a parent or guardian dates and signs it. And then that's it. That's all the forms. All right. So let's start talking about general liability and accident medical insurance. If I was gonna, as Laura put it earlier, we were talking, and if I was gonna put it in a nice, pretty little box for you, right? The general liability and accident medical insurance is for all approved Texas 4-H youth and volunteers. Period, the end. If you're working with people who are not approved volunteers and it's our function, then you need to seek an additional accident medical policy, right? And you can do that through American Income Life. American Income Life, or doesn't the university system, Doc Lock, don't they have something? Oh, you're muted.
Sorry, just go to American Income Life.
Just go to American Income Life. I've used them for years. It's very easy.
Yeah.
And they're very, very user friendly.
Yeah.
So I get the question a lot of times. Well, we're at our county fair. A county fair board is asked for our liability policy, and we have to sit here and say, but we're not the hosting. We're not the host. Y'all are the host. We're invited guests to that. And so you really have to think, are you an invited guest or are you the host for the event? And whether or not our policies will be quote unquote activated. If you have any questions on this, please contact your district specialist and they'll be able to answer any questions for you. So I guess the other big thing that I wanted to cover on general liability here, I have some notes on, is a lot of times organizations will ask for our general liability policy and they'll ask to be an additional insured. We can show them the policy. We won't be able to put them as an additional insured on the policy. Risk management won't allow it, and so we just won't be able to do it. But we can show them that we do cover, we do have a policy on all of our kids or all of our members and volunteers. Did I miss anything, Doc Lock?
Nope, you're good.
Okay, so the next thing that we want to talk about is supervision ratios. And so it's really important here that we have a minimum 1 adult to 8 youth ratio for all programs. All overnight programs, though, should have a minimum of 2 adult chaperones per gender. So I hope that doesn't muddy the waters. But if it's an overnight event, we need at least 2 females, 2 male chaperones. But if it's like a day camp situation, we need to abide by the 1 to 8 ratio. And so we will need to maintain a roster of all of those participants, youth and adult. We'll maintain that on record for 2 years. So the next thing we want to talk about is chaperone position descriptions. And so these 2 descriptions in our programs for minors, it says that we will go over their position descriptions and with our volunteers, with our chaperones at the event. If you don't have something specific for your event, use these as a template. I use these as a template for our leadership lab, and then I have to go in and tailor them to meet our needs of what the event is. But this is a very basic shell. This actually came from, oh gosh, Laura, where did this come from? A long time ago.
Yeah, it's not new. I don't remember. Darlene may remember.
It came from way back with Carol Bond, so just
Yeah.
it's
So,
yeah. Just use it as a shell, as she
use
said.
it as a shell and tailor it to meet your needs.
Use it
And
as
then
it is. Just have a description of what their duties are.
just make sure that they are fully aware and that you do an orientation with them before the event. So let's talk about communication between staff and participants. We want to make sure that all communication between minors and program staff is in place, and that there is a designated or official method of communication. So if you use social media, that's fine. Just make sure that everybody knows about it, and that we keep our communication professional and respectful at all times. I feel like we don't have to explain this a lot, but we probably do. We understand that, especially like when you're working with your local county councils or your local leadership groups, there's always these like group texts that go on. And that's fine. Just make sure that the language is professional at all times. So the last thing that I have on my list is the Texas Department of State Health Services form. And this form is for programs when there are 20 or more youth and the program is more than 4 or more days. And so I'll be honest, a lot of times, a lot of what we do is 3 days or less. And so very rarely do we get this form or do we see this form being used. But if you do have something that is 4 or more days and you have 20 or more youth in the program, then we really need to work to fill this form out and get it sent in. This is not an AgriLife extension form. This is very much a state of Texas form,
Department of State Health Services.
Department of State Health Services. And so it's really important that we get that done and that we abide by those regulations. When you are, Laura, just stay on that form for me right there. When we are on that form and filling it out, we are going to use all of our volunteers are going to go through their child protection training. They're going to do that to be a registered volunteer. So we know we have that. We have the course approval form, and then you'll just need to fill out the date that they completed that training, and you can get that information from 4-H Online. So, Darlene, am I missing anything on that form? This form can be faxed or emailed, but we want to make sure that you keep that documentation that it was sent. So, for instance, if you're faxing it, make sure you save that fax receipt. Emailing, get a read receipt on that email, stuff like that.
Just on this form, this is if you are any part of 4 days, not, it says any part of 4 days or any part of 4, go back to the definition, for any part of 4 or more consecutive days. So if you have a week-long day camp, Monday through Friday, and you have 27 kids there, you should be filling out this form and sending it to DSHS. I have filled out probably 10 of these forms over the course of my career, and probably 8 of them, I get a notice from DSHS, why are you sending this to us? Don't worry, just do it. And as Meredith said, keep the documentation that you sent it and that it was received. They're a huge bureaucratic organization, and they don't always understand why extension people are sending these forms, but the A&M system rule tells us that we have to send this form. So just do it, keep your documentation. And then down there if you're, even employees, you would report county extension agents on this form. And you can ask the agent to go into their train track and get the date that they last completed the child protection training. But the child protection training course that's in train track and that's on 4-H online is that same course approval number. So I just put that in there. It'll be the same always.
And it says employee name here, but it's employees and volunteers that you'll include on this.
Right. Yeah. And so, yeah, that's it on that one. Okay. There is a question over here. I didn't use an insurance, and why I didn't use an in-house insurance for my camp. Is American Income in-house? No, not technically, but through the 4-H unit, there is the Texas 4-H Inc. that has the American Income Life policy that covers all of our approved 4-H members and volunteers. I don't know if that's considered in-house, but the 4-H youth membership fee is what pays for that insurance. So I guess you could call it an in-house, but as long as you're.
Now, Doc Block, I think what she's referring to is the question that I asked a number of years ago when this was introduced to us. There was some system insurance that we could take out.
There is.
And I think that's what she's referring to there. It's not easy to get it. And so I think we default to American Income Life just because it's easier to attain it.
And also you could further say that you use the American Income Life because all of those participants that are already 4-H members are under American Income Life. So I want to ensure my other participants under the same program. That would be a reason why you didn't use an in-house, which would be the program insurance that you can get through student activities at A&M. And you really get questions about, why are you calling us? You're not on campus. But yeah. Okay, we're getting short on time, but we do want to allow Laura next to show you, now that you've done all these items, that part about entering it into the form site.
Okay. Yeah, so if you recall, I've gone back to the top of the page here, and we're gonna click here to document the program for minors. Okay, so I have created a profile already, or you can do a new profile. And you can see I started to play with a dummy one here, or I can click start new. So that's where we will start. Here is some information about the definition again, and examples and all that fun stuff. So we're going to go and answer these questions. This is just like that decision tree. Is the camp sponsored and operated by AgriLife Extension or a third party using extension facilities? So the example I'm going to use here today was like my district leadership lab. So I'm going to say yes. Question 2, is the camp or program scheduled for more than 2 consecutive days, and or does it involve an overnight stay with full supervisory responsibilities of minors? I'm going to say yes. And is it taking place at the 4-H center, and will they be collecting and archiving required information? In this case, I'm going to say no, because we're going to go somewhere else for leadership lab this year. Because if you go to the 4-H center, once again, they'll document that for you. So you can hit save progress and come back to it, or we can hit next. Okay, so we're going to fill out this form. Let's say I'm the contact person, and we're going to add some information in here. And the program type, my options are, is it run by us, by AgriLife Extension, or is it a third party using our facilities? So in this case, we're going somewhere else, and so it's run by us. I'll add my email. And add that. We're going to call this. And I like to put the year in here just in case, to help search for things, you know. Did I do it this year? Did I do it last year? And the example I'm using, we went to T-Bar M in New Braunfels, Texas. The beginning date of the program, let's just say we're going June. Let's pick a little date picker there. Number of consecutive days, I think I picked 4 days. Did we have overnight stays? Yes. Number of participants, we would average 150 kiddos. Volunteers, something like that. And number of employees, something like that is about what we would take. You can, if you'll say here, this can click over the little question mark. This can be an estimate and a corrected at a later date if needed. So I just put in an estimate. Verification, were there 20 or more minors in attendance at the program held for any part of 4 or more days with or without an overnight stay? So yes, we were there for 4 days. This is that question about the DSHS form. So I'm going to say yes in this case. Now we're going to go down to our required documentation. If you recall, if you filled out this form in the past, you had to enter a date in there. But now what we're just asking for is a yes or a no. Is it approved in writing in your plan of work, AKA Texas Data, that you have an approved plan? So like I'd have Leadership Lab in my program plans and my plan of work on Texas Data. So yes, it was approved. Background checks have been completed and approved for employees and volunteers. Employees are screened through human resources. So if you're an employee, assume that they're screened. And then volunteers through 4-H Online, all that stuff we talked about before. So yes, I've got that documentation printed or saved in my files, my electronic records. Procedures are in place to prohibit communication, including by social media between minors. Meredith talked about this. And if you mouse over this description, it says this requirement can be met during chaperone orientation and also in the volunteer position description. So I'm going to say yes. I should make this a little bit bigger. Procedures are in place for reporting suspected abuse or molestation of minors. Again, that can be, that's the law. And we are going to talk about that in our orientation and in our position description. The ADM forms are collected. The HSS is collected. The OTC form is collected. And, oops, it says SAT instead of SAP. That form is collected. So again, some of these forms are required and some of them are recommended. So make sure that you're following that list. So yes, I'm collecting those during registration. Again, we've got the waiver here saying that we're going to collect that. Our risk assessment matrix, all that stuff we talked about a while ago. Again, I kept mine on an Excel spreadsheet, some filled out the actual form. Either way would be okay. So yeah. We have the position descriptions distributed and we've done an orientation, or excuse me, this is just the position description for volunteers and for employees. We've had the orientation.
And on that orientation, click on the how you do it. What you want to ensure is that you have perhaps in your agenda for your event, there's a place that says chaperone orientation.
Yes, document that. Good point. Adequate ratio, the 1 to 8, like Meredith talked about. And then this is key, a roster is kept, maintained for 2 years. You've got your ADA accommodation statement that we're going to include on our promotional materials ahead of time. Yeah. And we've got our general liability and accidental medical insurance covered. Again, if they're approved, then they're covered by these policies. If they're approved in 4-H Online, oh, there it is. Oh, I guess we need to update this too. The term has changed from active to approved 4-H Online versus 4-H Connect, but that's fine. Y'all know what we mean. Verified that the employees and volunteers have completed the child protection training. Again, if they're approved in 4-H Online, then yes, they've done it. And then is this form required, the DSHS form? That's the one if you have 20 or more participants for part or all of 4 days with or without an overnight stay. And in this case with Leadership Lab, we were going to be there for 4 days. So we're going to say yes. And then you would enter the date that you completed this form and it must be submitted, what does it say, within 5 days of the start of the program. So if I started that program on the 21st, I would need to make sure I had it submitted sometime the week before. And this is your last step. Did you meet all the requirements? So above, I've said yes on everything. I've met all the requirements. So here I'm going to say yes. And I can submit it or I can save my progress. And I can come back and do it. Darlene, you want me to submit it?
Sure.
Or not to? Okay, submit.
That way, you'll get the receipt that you submitted it. It goes directly to me, and then you'll get a report too of it.
Yeah, I printed off one of my, or not printed, I opened it. This is an old one I did.
It'll
Oh,
look very similar to this.
yeah, here it is. Oh, it's still scanning. I can't open it yet. But my emails come through. It came through that quickly. So you know that it's there. So I'll go back.
So essentially, the form site is really just your checklist that you've done everything that you should do. All of those questions you should answer yes to, except for the one about the DSHS.
Yeah, that may be a no. And so here's what I got from there already. Oops, I guess I could make it a little bit bigger. But it shows my answers to all of these questions. Look, and I said yes. Aren't I so good? Okay. That was a lot.
We have tried to create something that hopefully is easy enough to follow through, and that we provide you enough resources to be able to answer the questions and to do the documentation. But again, the important thing when you've got that all done is that should you leave that position and move to another county, do not leave your colleagues in a position where they could not find that documentation if your particular program was questioned. The other reason we have that documentation, if there is an incident that involves a youth, those individuals have until the age of maturity to suggest that something may have been done wrong. And so we need to be able to retrieve documentation, excuse me, that, that they had given permission for this and they had consented to these different things. And so the length of time that you have to maintain documentation, once that length of time has lapsed, we can delete those files unless you have had some known incident with a particular youth. Then I would encourage you to keep that one individual use documentation like forever, but you should delete all the other files. That's our documents retention procedures. And if it says keep them for 3 years, keep them for 3 years. And after 3 years, you can destroy them.
And not just in a trash can. Remember, we're HIPAA and all that stuff. They need to be shredded.
Correct. Yeah. Are there any questions that you all have? I appreciate that there's still over 50 of you online with us. I know it's been a lot of information. I don't see any other questions or comments in the chat. I would just plan on finishing off this afternoon by saying that I get the opportunity to review all of your programs for minors events, but I'm also very happy and willing to help and assist you in any way in meeting these requirements. We certainly don't want you to feel like you're out there on your own to figure this out. So please, feel free to reach out, and email is the best way probably to reach me. So please feel free to do that. Thank you, Natalie.
Yeah,
Emily.
thanks, y'all. So certainly reach out to Doc Locke, reach out to your district specialist.
Right.
I don't want to say we're all seasoned veterans and pros.
They are.
I certainly don't feel like a pro some days, but if we don't know the information, we know how to get you the answer.
Exactly.
And so use your district specialist. They really can be your best line of defense and assistance in a lot of cases.
All right. Thank you all. Thank you, Laura and Meredith.
Thank you. Y'all have a great rest of your afternoon.
It's Tuesday.